So thank you so much for everybody for joining us today to learn a little bit about what we are doing here at the Iowa State College of Veterinary Medicine to respond to COVID-19 and the pandemic that really is afflicting each and every one of our lives on a daily basis. So again, thank you for coming today, and we hope that we can share some information that helps you understand what we're able to do, and then also, most importantly, answer any questions that you might have about our response. So first thing I want to do is just remind everybody a little bit about the missions that we have here at the Iowa State College of Veterinary Medicine. And really there are three missions. And the first one is education. The second one is really discovering and disseminating new knowledge, and that's our research mission. And then here at the College of Veterinary Medicine, we also have a service and outreach mission, which we deliver through our extension, our hospital, our veterinary diagnostic lab, as well as our pathology services. So during the past 3 months, as we have responded to COVID-19, really we have looked at each of these three missions and asked our question, what do we need to do within each of these three missions to continue meeting those missions? So before I get started, I just wanted to kind of share a little with you about the timeline of COVID-19 here in the United States, and also how it kind of intersects with what we've been doing here at Iowa State University. So just a reminder, this pandemic really has only been affecting us here in the United States since the first of the year. So the first case of COVID-19 in the United States was diagnosed in the state of Washington on January 21st. The first case in Iowa was a little bit later, so it was actually almost 2 months later, or a month and a half later, that the first case was found here in the state of Iowa. So that was on March 8th. And then because of soon after that, there was demonstration of community spread within the state of Iowa, as well as other places in the United States, Iowa State made their decision to move their educational enterprises to online. So that decision was made on March the 16th of this year. And then not too long after that, the first case of COVID-19 was discovered in Story County, which is the county that Iowa State is located in. So as you can see, within 3 months, we had gone from the first case in the United States to finally a case being located here within our community at Iowa State University, or at least within the county. The first case at Iowa State involving somebody that works here at Iowa State actually didn't occur until 2 months later. So on May the 8th is the first time that a member of our Iowa State community was first diagnosed with COVID-19. A day later, we celebrated the graduation of the class of 2020 with our virtual graduation, and I'll share a little bit of information about that graduation later in the presentation. Amongst COVID-19, another unfortunate incident occurred, and that was the death of George Floyd on May 25th. So amongst us dealing with COVID-19, we also needed to deal with and work with the situations that evolved around the death of George Floyd and the subsequent protests and riots that were occurring around the United States. And certainly here at Iowa State University and in the Ames, the discussions about social justice and Black Lives Matter certainly occurred here as well as they did around the United States. First case within our community here at the Iowa State College of Veterinary Medicine occurred on June the 12th. At that time, that was the first member of our community that was known to be diagnosed with COVID-19. I'll share with you later, but as we sit here today on July 22nd, we have had 4 members of our community that have been diagnosed with COVID-19. So in some respects, I think we're lucky in that we haven't had large numbers, but we certainly are very cognizant of the fact that members of our community can get affected, and certainly there are repercussions to that. On July 6th, so actually just about 2.5 weeks ago, our students who are in their 4th year of their veterinary medical clinical training program returned to the clinics. And so we're so happy to have those students back. I'll talk a little bit about that here in a second. And then what we are currently planning for is all of the Iowa State University students, including our students that are in their first 3 years of their training program, will be returning to campus on August the 17th. So this is just kind of a brief timeline of kind of what's been going on over the past 6 months here within our community and across the state of Iowa. So what I want to do now is just talk a little bit about how we have responded to each of our 3 mission areas during the past really 3.5 months as we've been dealing with COVID-19. So one of our primary missions, as we mentioned before, is really education. So that's teaching the next generation of veterinarians. It's teaching the next generation of scientists. It's training, providing advanced training when it comes to our house officers, our residents, and interns. So starting in March, we had to come up with some different ways of really training our students here. And this can be, as you can imagine, somewhat challenging, especially when you're talking about a clinical veterinary education. So the first thing that happened was on March 16th, we had to transition all of our training of our first 3-year classes, so our VM1 through 3 classes, to an online training program. So this occurred on March 16th, and then it continued through the end of the semester, which was roughly about 6 weeks. Our 4th year students, who at that time were in the clinic, so these are the students that would have graduated back in May as the class of 2020. Those students were actually then, all their face-to-face training was suspended, and they were moved then to basically an online training program where we offered them limited number of online clinical training offerings. So this occurred for really the last 3 clinical blocks of their clinical year, which is really the last 6 weeks of their education here at Iowa State University. So that was unfortunate in that we had to move the students out of the clinics, but during that 6 weeks, we were able to provide our students some quality online clinical training offerings. Our faculty pivoted very quickly. That is, our clinical faculty pivoted very quickly, and we're able to do a really good job of providing a substitute for that face-to-face education. So that got us through the end of the previous school year, and then we had to start thinking about the VM3 students who transferred into or were transitioning into their 4th year clinical year. And then also, as I'll talk about here in a second, we had to start planning for what we're going to be doing this coming fall. So the VM4 class now, they became VM4s on May 11th. They are our class of 2021. Folks will be graduating next May. We made the decision to actually start their training program not in the clinics, but using online rotations, preceptorships, and in some cases, some of our students took vacation blocks, which are part of their 4th year. So this really occurred for the first 8 weeks of their clinical year. And our faculty quickly rolled up some online clinical rotations. This included didactic work. It included virtual rounds. We set up cameras on top of clinicians, cameras in the surgery room so that we could actually record surgeries or record clinicians doing physical exams or doing procedures. So there were a lot of innovative ways and creative ways that our faculty were able to actually engage with our students as part of these online rotations. We also got special permission from the university to allow students to be able to continue doing preceptorships if those opportunities existed. And so as a reminder, preceptorship is where our student goes out and works in a private clinic or a specialty practice or in some type of other clinical setting that's outside of Iowa State University. So there were a few opportunities for our students to continue to do this, and we allowed them to do it if they followed specific rules that help to protect not only their health and safety, but also the health and safety of the preceptorships that they went into. The good news is that 2 weeks ago, on July 6th, we were allowed to bring our students back into the clinic. So we opened the hospital back up fully, have re-engaged our students in the clinics, and it is certainly our plans as of right now to continue having our students in the clinics throughout the rest of their fourth year clinical training year. For this coming fall, as I mentioned, we will resume training of our VM1 through VM3 classes starting August 17th, and this will be done in a hybrid format where we will be combining online and face-to-face education. So primarily the large lectures will be provided online to the students, and we will prioritize face-to-face interactions in our laboratory setting. So like an anatomy lab or a microbiology lab, so forth and so on. So currently our faculty are working very hard to bring these courses together because, believe it or not, we are about 3 weeks, a little bit over 3 weeks before our students return to continue their education. So just a few pictures. This is kind of some pictures from this fall when we delivered the remainder of the spring semester virtually. And again, our faculty did a wonderful job, just an outstanding job in very quickly pivoting and spinning up virtual classes for our students. And they did it in a variety of different ways that were truly incredible and certainly truly creative. And student experiences, just a few pictures of the new classrooms for our students. So you can see that our students set up their own classrooms in their residence, in their living rooms, or in some cases outside when we had beautiful days this spring in Ames. And then the final picture I have here is just of our fourth year students who have returned to the clinics 2 weeks ago. We have put in place protocol, standard operating procedures, mechanical barriers, all the things necessary to help reduce the risk that we have COVID-19 being brought into our facilities, and most importantly, if it would happen to be brought in, to be spread. So all of our students, all of our faculty, all of our staff are now required to wear face coverings, whether that's a face mask or a face shield. We set up rounds and a variety of different teaching opportunities with physical distancing put in place. And we have also enhanced cleaning of our hospital facilities to reduce any potential virus load that might exist. So the great news is 2.5 weeks into our clinical or resumption of clinical training. So far, so good with all of our students staying safe and also our faculty and staff staying safe as well. Just real quick, one of the unfortunate problems that occurred with COVID-19 is that our graduation, our typical face-to-face graduation, can no longer occur. And so we pivoted graduation to a virtual graduation, which really was done quite well from my perspective, and certainly well received by our students, as well as their loved ones who were able to attend that virtual graduation. And by the way, I put up here on the screen the link to that graduation. And if anybody would like to watch that, it is recorded, and you certainly can enjoy that graduation if you wish. And this is our class of 2020. So proud of this group. Unfortunately, their last year, the last semester of their clinical training year was cut short. But they were so resilient in adapting and doing the things necessary to get through the end of the year. We're so proud of this group, and I know that they're going to go out and be great members of the veterinary. Just real quick, just to let you know, we're thinking about our next crop of veterinarians, so our next class of veterinarians, and the class that we will be welcoming here in 3 weeks, the class of 2024. We've got a full class. We had over 1,600 people apply to be members of our class, and the class that is currently seated includes 155 students. And you can see the breakdown of where those students are going to be coming from. 60 of them will be here from the state of Iowa. 25 will be from the University of Nebraska-Lincoln, which we have a special arrangement with. And then contract states will have 6 students from each from South Dakota and North Dakota. And then the remaining 58 students will be coming from other states and countries from around the world. So next thing I want to talk about real quick is research. So research, again, is another one of our important missions here. And so during the summer, research has continued. Research in all aspects, so whether it's basic research or applied research or field research, we have been able to continue fulfilling that mission. One of the things that I wanted to share with you, though, is that one of the things that our faculty has done is quickly pivoted some of their research to address COVID-19. And the folks that you see here on this slide are some of the faculty within the College of Veterinary Medicine that are now trying to answer important questions with respect to COVID-19. So many of the research projects going on are now revolving around vaccine development. So applying novel strategies or novel technologies to developing new and innovative vaccines for COVID-19. We have some faculty that are working on novel therapeutics for COVID-19, diagnostics as well. We have folks that are working on rapid diagnostics that could be person side or deployed within a hospital setting or anywhere within the field. And then importantly, as with any disease, really helping to understand how to control and prevent a disease really starts with understanding the pathogen or the virus. And so in this case, we have several faculty that are actually looking at and trying to understand the very basic biology of the virus that causes COVID-19. So very, very proud of our faculty that have pivoted quickly their research, taken their expertise, their technologies, and then thought about creatively how they can apply that expertise and technology towards responding to this pandemic. So our third mission then is service and outreach. So this is where this is our hospital, our diagnostic lab, and our extension services. So I want to talk a little bit about how each of those have responded to COVID-19. So the first one is extension. So this is really our outreach service that works with industry partners in really translating the knowledge that's at Iowa State University and getting it into the field where it can actually be applied. And during the last 3 months, our extension service has done unbelievable things to try to help stakeholders across the state of Iowa, and primarily stakeholders involved in animal agriculture, in dealing with this the impacts of COVID-19 that has had on agriculture. And a variety of different things that they've done. Specifically, first of all, they continue to do the things of providing information and resources to our animal agriculture industry, an industry which is a $32.5 billion industry here in the state of Iowa. So an incredibly important industry that needs to continue to be supported. You know, some of the unfortunate things that have been going on with COVID-19, as many of you are aware, is the disruption in basically the supply chain of animals going from the farms to slaughter and then to the retail markets. So that supply chain has really been disrupted. And because of that, there's been some unfortunate things that have had to occur to address that disruption. And our faculty, our extension staff, have been front and center in helping producers and farmers, veterinarians across the state of Iowa and beyond in dealing with some of these unfortunate consequences, such as mass depopulation, or the fact that we needed to slow animals down, slow the growth of animals down, so that we could slow down the kind of the production chain that was going on. And then certainly because of animals kind of backing up within the livestock pipeline, lots of animal welfare issues have surfaced, and our extension personnel have been front and center in helping to deal with some of those welfare issues. So the last kind of mission that I want to talk about is our service, or our to continue talking about is our service mission. I want to talk about the Veterinary Medical Center our pathology services, and then Dr. Main's going to talk a little bit about the veterinary diagnostic lab. So the Lloyd Veterinary Medical Center is our teaching hospital, and our teaching hospital, we had to make some decisions early on as to how we would continue delivering services from our hospital, especially with our students being pulled out of the hospital because of safety concerns. So what we decided early on was to, our small animal hospital is to move to emergency or critical care services only. And the reason for that is basically we wanted to make sure that we had enough personnel in place to provide continued quality care to our clients and their patients. So we really focused our services down on those emergency and critical care services. And so that's really what's been going on since the middle of March until just recently when we brought our students back, when we then started ramping back up our other services that would include less critical patients as well as elective procedures. On our large animal side, we elected to keep all of our large animal services moving intact. And the main reason for that is because our large animal services service the livestock industry, which are critical to food security. And so the importance of having or being able to continue to service farmers and their livestock was so important that we elected to keep those services. So again, so proud of what we've been able to do over the past 3 months in continuing to provide services to clients and their patients, especially those that have critical health issues going on. And we've been able to do this again safely and efficiently during this time. As I mentioned, our veterinary field service, which services the livestock industry in about a 30-mile radius around Ames, continues to provide service to these clients. Again, the reason that we continue to do this is because of the importance of food security, as well as the importance of these animals to the business enterprises of these individual producers. So the last service that I wanted to just visit with you about is our veterinary pathology service. This is a service that provides biopsy service as well as necropsy services here to our hospital, as well as referring veterinarians around the state of Iowa. That service has remained intact and continues to provide services, again, to referring veterinarians actually all over the Midwest. And they've done a wonderful job, again, of continuing to do that service. So next, I'm just going to transition over to Dr. Roger Main. I'm going to stop sharing my slide, if I can do that here. Stop share, and we're going to transition over to Dr. Main, who's going to talk about the veterinary diagnostic lab and what they've been doing for the past 3 months during this response. So Dr. Main, you're up.
Good afternoon. Appreciate the opportunity to participate. And as Dan said, my name is Roger Main, and I serve as the director of the diagnostic lab here. Like many folks or everyone on the call, there's been a lot of change and disruption associated with the COVID-19 across the board. And there's a few things here at the diagnostic lab. Probably the biggest thing for us has been that we've been able to maintain the continuity of our services and all of that, throughout the course of since the onset of the pandemic. And we really feel fortunate for being provided the opportunity to do that and to be able to serve our, core veterinary clients here in Iowa and throughout the country. And just can't say how proud I am of our people for really stepping up to serve in the time of really some unprecedented needs of our clientele. And I mentioned this to some, it might be kind of surprised, is here at the lab, actually, March and April of this year were actually the largest caseloads that the lab here has ever experienced in its history. And just to write out 10,000 cases a month. And I just can't say enough about our team here that was kind of able to step up kind of during the midst of that chaos and deliver on that. And so we really, feel fortunate for being able to do that. And and really proud of our team for stepping up to do that. And then kind of while that's been going on, we've also ventured into a new area, more directly on the human health side, with this COVID-19 response and helping to support the response in Iowa. And that all started it was interesting. It was a call we had set up with the State Hygienic Laboratory, which is the core human health reference laboratory in the official human health reference laboratory in Iowa. It's located in Coralville, Iowa, and associated with the University of Iowa. And we had reached out to them and said, is there something we could do to help? Because those early times, there were some very significant limitations and extraordinary limitations in testing capacity and so on. And so we reached out to them and had a call. It was on March 19th. It was a Thursday afternoon. And we had a call at 3 o'clock, and it was really good. And out of that call, it became very clear what their most immediate constraint was. And so that was on Thursday afternoon. And by Friday morning, the following morning, as we had loaded up a number of instruments associated for high throughput PCR testing that we routinely do here in the diagnostic lab, and as well as with our high throughput extraction or nucleic acid extraction reagents, which is foundational for the PCR testing, and all the plastics and reagents to go along with that. And we took that over there on Friday morning, and then had some staff go with the instruments and so on. And then by Saturday morning, or Saturday at 1, they had put the instruments kind of in place and onboarded on Friday, had done some initial validation of those platforms in their hands on Friday night and Saturday morning. And by that Saturday afternoon, they had transitioned all of the testing going on in Iowa at that time over to the use of our high throughput nucleic acid extraction and then PCR platforms. And so that's kind of how we got into it, as far as helping most directly with supporting the team at the Hygienic Lab, who's just been absolutely great for us to work with. I cannot say enough about that. And Dr. Mike Pintella is the director there, and them and their team have just been really, really good. And then over the next few weeks, couple weeks into that is, we actually made some additional shipments of equipment, additional equipments of reagents. And then actually a faculty member here at the lab, Karen Harmon, and a molecular diagnostician faculty member here at the lab, along with the help of a key staff member named Laura Bradner, they were actually able to develop a single well based PCR test, so meaning one well, one test, for the COVID-19 PCR testing. Because at that time, the test that had been approved by the FDA that was being used was actually requiring 3 PCRs tests for every single sample. And so, so it was 3 wells, and the cycle times and so on are 1.5 hours plus. And Karen and her work, using the technologies that we're using here at the diagnostic lab, were able to say, well, let's create an assay based on CDC guidance, based on the targets provided by CDC, to get that all into a single well. And then, oh, by the way, the assay can be done in half the time. So it takes, so by doing that, you have this additional, multiplier effect of test capacity. And so the State Hygienic Lab, over that course of time, was being able to adapt that assay. And that equipment and those assays and the reagents that we provided were very critical because the state of Iowa could not get access to any of the more centrally available assays and reagents and so on. So it was a really great partnership and helped kind of get the state of Iowa's capacity off the ground. And again, can't say enough about how good the hygienic lab and their team, who's been working around the clock on this since the beginning, have been good to work with. And then in the third week in April, so now we're about a month into that, is we were at a point to say, okay, well, what else could we do? What synergies could there be? Because we knew by us helping take the technology to the hygienic lab in the form of instrumentation, reagents, and so on, everything could be done there. It fits under their CLIA umbrella. You know, they're set up to, you know, get all the samples from human patient clients, network, all that. It was just way more straightforward. And then as we got into the third week in April, we're like, well, what is there something else we could be doing? And out of that, it said, well, yep, there probably is, to say, well, maybe we need to get set up here to be able to do some testing in the College of Vet Medicine under the VDL umbrella, and say, how could we do that? And of course, that's a totally different space, a totally different system of certifications and so on that go on with doing human patient client clinical testing. And so we said, well, okay, that makes sense. We need to do that. Everybody was in agreement. And so how do we do that? And what role could we play? And so at that time, the original role, it was intended to say, well, we really think there was a prevailing thought at the time that this antibody testing will become very important as we get into this outbreak, especially the further we get into it. And so the thought process was to say, well, maybe what we should do, because getting the information, or instead of trying to plug all that to go through the same hole, maybe a role that we could play would be the primary site for antibody-based testing in Iowa. Okay. And we said, yep, we can do that. And so then we went down a path of basically achieving, having to get the what they call the CLIA certification. So that's the certifications associated with doing human patient client clinical testing. That went very straightforward. And then probably the bigger thing was to say, well, we have to get a system set up to say, well, how are we going to receive information from human medical providers and then report them information? How do we do that? And so we went back and forth with the hygienic lab to say, well, were they going to let us use their system? Do we do that remotely? Or do we need to do something set up here? And what most people probably might not realize as it relates to testing capacities and things like that, but a core issue, one of the largest constraints that the hygienic lab is facing, or with capacity at that time, was related to getting the information into the system. And so basically is entering all of this human patient demographic information, you know, into their laboratory information management system for the information that's provided from the healthcare provider, a very significant issue. Takes about 6 minutes per case to enter them. And so you do the math, that's 12 samples an hour for every case entry technician person that you have doing it. And so we better understood that, and we're like, gosh, if we're going to be able to provide a scalable thing here, maybe it would make more sense to us to say, for our use cases, to go ahead and just make a modified version of our existing client portal, which utilizes online-based submissions, and then a laboratory information management system, and modify our existing system for the human patient use case. And that was about the third now into getting that fourth week in April that decision was made. And then really from then, and then kind of over May, we did two things. One was we made all of that, our IT crowd was working around the clock to get this new version of LIMS and portal set up for this COVID-19 testing. We got the we got the portal going, the LIMS up and going, that being developed. We were fortunate to have a space at the college that we basically repurposed a large classroom down in a wing. It's a more of a remote area of the college here, and then actually the student fitness room and in May repurposed those spaces to be a COVID-19 lab space. Okay. And by mid-June, we had all of that spun up. We had went through all the CLIA certifications. We also had to go through and undergo a HIPAA review related to the security of our system and ensuring compliance from stem to stern for about managing the patient's, human patient's security. And by June 15th, we had that system launched and then began to receive samples and so on from human patient clients, with the initial focus being on the antibody-based testing. And then in the middle of all that, probably right in that early June, it was becoming clear that, well, people are still having problems with access to PCR testing. ISU had plans or interest of providing testing for students coming back. There's significant issues around needing to test the student athletes coming back to start their training, which started basically June 8th and then June 15th again. And so then it was like, well, let's go ahead, and we brought on the PCR testing as well for the COVID-19. So we got CLIA approved for the PCR testing, started doing that for ISU on the mid-June ISU use cases. And then over the 4th of July, we started providing some of that COVID-19 PCR testing for some of the local healthcare providers. And that's kind of where we are right now in that process. And that there's that whole PCR testing here is going to get ramped up in a significant way starting next Friday, as the university is going to be doing some testing of undergraduate students returning to university owned housing starting next Friday, the 31st. That will continue up through the middle of May. I think it's for the 14th or 15th, something like that. And then there's a number of other current things that are going on that we would be much expanding that PCR test. The scope of the PCR testing that we're providing would, with a number of things that are currently going on, would look to take a significant step change increase there in the middle of August. So that's kind of what our team here at the Diagnostic Lab has been up to related to the kind of throughout the course of the last 4 months. So Dan, I'll be quiet and turn it over to you, I guess.
Thanks, Roger. A great update. And I just want to reiterate how great a job that the Diagnostic Lab has done in number one, continuing to do their primary mission, which is really supporting animal health here in the state of Iowa as well as broadly. And then also really pivoting and doing things to help our state respond to COVID-19 on the human side. So just really extraordinary effort by Dr. Main and his team, as well as a lot of other people that have helped to make that possible. So with that, I think really that's what we wanted to share with you. There's a few questions that have come into the question and answer box. So I'm going to try to answer a few of those here very quickly. So first of all, Dr. Crow, thank you for the question about potential ideas for diagnostics. Dr. Crow, what I will do is contact you independently. Thank you for your phone number as well as your email. We'll talk about your ideas, and then what I can do then is get you in contact with the best people that you might be able to talk to and your ideas. So that's one of the great things about Iowa State and our community is there's people have great ideas out there, and it's nice to be able to take those ideas and look at them and then potentially figure out ways to move those forward. So thanks for that comment, Dr. Crow. Another question is we're asked what we did to keep the hospital open. So as I mentioned back at the 1st of March when we made the decision to pull the students out of the clinics, we also reduced the capacity or the services that we provide by the hospital. On the small animal side, we went to really just emergencies and critical patients only. On the large animal side or the livestock side, we continue to see patients because of the importance to those patients, to the business enterprise of the individual farmers, and also because of food security. On the small animal side, we developed standard operating procedures and protocols. Actually, they were works in progress as we learned more about the virus and we learned more about what we needed to do to make sure that we protected our employees. Certainly increased PPE. We moved to curbside check-in, so clients would bring their patients to the entrance to the Lloyd Veterinary Medical Center. They would call us, and then we had specific people that would then go out, meet the clients, collect their patients, and then bring them into the hospital for evaluation and treatment if needed. Communication between our doctors or our technicians and the clients was done by cell phone. So, one of the nice things about cell phone is we could continue to have those conversations back and forth with the clients. On the large animal side, basically the clients would not come in the hospital. So if they were bringing a horse or a cow or whatever livestock that they were bringing, they would unload the animals into our hospital, but they would not come into the hospital. But again, communication would occur back and forth via phone. So that's how we've been able to maintain services. As I mentioned 2 weeks ago, or actually prior to that, we began ramping up non-critical services on the small animal side, services such as knee surgeries and some of the non-critical dermatology services, so forth and so on. And so we're slowly ramping those services back up and offering those services back to our clients. There was a question, let me go over here. There was a question about a letter from Dr. Winterstein that was to our CVM community. So for those folks that would not have seen that communication, our president, Dr. Wendy Winterstein, sent a communication to our community earlier this week, just really thanking everybody here in our community that has continued to work and to provide really critical services, both on the hospital side as well as the laboratory side. Just thanking them for continuing to do that and provide those critical services. The question was, is there the potential, or might there be the potential for tangible rewards down the line? I can't speak for Dr. Winterstein. I don't know what she's thinking. But what I can say for sure is that everybody here in the College of Veterinary Medicine, everybody at Iowa State University, and certainly people beyond, our stakeholders, our referring veterinarians, our clients, are so grateful for what we've been able to continue to do for the last 3 months during COVID-19. And we certainly get those thank yous and those accolades from those folks on a daily basis. And so I can't thank our faculty, our staff, and now our students for continuing to provide essential services to our clients and to really the entire stakeholder and all the people of the state of Iowa. So I'm just looking around to see if there are any other questions. A couple other things I just wanted to share with you. So Roger mentioned, Dr. Main mentioned the fact that our diagnostic lab is really stepping up to help with the COVID-19 response on the human side. One of the things that the laboratory will be doing is providing testing of students as they return back to campus here in 3 weeks. So there will be a testing program in place to test students, faculty, and staff that either are showing symptoms of COVID-19 or maybe are part of a contact tracing situation. So our laboratory will be front and center in helping to provide that support. The other thing is because we are the only medical college here at Iowa State University, folks in our college that have expertise in infectious diseases, in public health and epidemiology have been tapped quite a bit to provide their expertise, their opinions on how the university needs to move forward. So they've been involved in developing the testing programs that the university is going to utilize. One of our faculty now is head of the or is director of the public health testing center that has been stood up to help respond on the public health side. We have faculty that are part of the planning process for bringing the students back in the fall at the entire university level. So a variety of or many of our folks are involved in many different aspects of helping the university to navigate this certainly unusual time. Roger, I don't know if you can see, but there's a question about the veterinary diagnostic lab. Can you pull up the chat box there, Roger? It's actually not in the chat, but the question and answer pod.
Yeah. The question was about, did this experience and us propping up this kind of human patient use case laboratory and capabilities, does that impact any of the planning process that's going on for the current veterinary diagnostic lab that's planning to be built? And I would say, in short, is it sure raises questions. It definitely shows how the hygienic lab and how the diagnostic lab can work together to respond to emerging infectious disease things. And I can tell you that's part of this things that are going on right now is there's a lot of interest on both sides of this One Health approach between the hygienic lab and us, that we could certainly see the synergies between those different laboratories and respective institutions continuing to move forward past the days of COVID-19. So I think in short, the answer would be yes, for certain, that the lessons that we're learning and that I think come out of this will be on our mind as we continue to look forward to the new laboratory. In the very near term, as it relates to the new laboratory, is and Dean Grims may speak to that later too, but basically we're looking forward for that project to be moving forward in earnest this fall. In the new building that's going to be built it's basically defined, and it really doesn't have any of the what I would consider more the ancillary bacteriology is the only really ancillary lab in the new building. And so all the molecular testing and serology testing and so on is all still going to be in the existing space of where it is today. So certainly we'll learn from this and look forward as we look to if we would be fortunate enough to go forward with a subsequent project that would build complete the entirety of the VODL operation. But in the near term, those ancillary testing labs really are not in the new building.
Thanks, Roger. Appreciate that answer. So another question that is from Dr. Crow. Dr. Crow, thanks for the question. And he's asking if the pandemic worsened and overwhelmed the current healthcare system. I was not sure you knew that the AMA, with the National Disaster Life Support, has trained many vets to care for people, and was wondering if veterinarians could be called upon to help in this setting. So I don't know a specific answer to your question, Dr. Groh, but we certainly have discussed here within our college, and I know in other discussions that I've had with fellow deans from colleges of veterinary medicine around the United States, that we certainly feel that our veterinarians and that our profession would certainly be somebody that could help respond to this pandemic. So I think you're right on there, and I know that those discussions are being held broadly on how the veterinary profession could further, because I think we are helping to respond already, but how we could further help to respond to the pandemic. So thanks for that comment, Dr. Crow. Okay, I'm not seeing any other questions at this time. Dr. Main did mention that we are soon to be starting our new veterinary diagnostic lab. Groundbreaking hopefully will be this fall, and with a completion date in the fall of 2023. We also are moving forward with other projects here at the college. We're in the midst of renovating one of our larger classrooms to make it a more flexible space, and also something that's more adaptable to different methods of teaching. That classroom 25-23 will be completed this fall. We are almost finished with the renovations and additions to our veterinary field service building. That renovation includes additions of modern classroom spaces and also some teaching laboratory spaces as well. So that project's on tap to be completed later this summer when students return. We also have updated our lobby, our main lobby, which is affectionately known as the fish tank lobby. That space is being updated to be completed by August, so not too far off, but it'll just provide another updated, wonderful entrance to our college, and also a great place for our students to meet, for alumni to mingle and network, and lots of other kind of upgrades to really just make it a nicer space. So despite the things that are going on with COVID-19, we continue to make improvements within our facilities to really make it a great place for our faculty and staff to work, and importantly, a great place for our students to learn. So Tracy, we're about 5 minutes from the top of the hour, and I don't see any other further questions, so maybe I'll just turn it back to you, Tracy.